is ramping up. You've likely seen the pollen in the air. Now, due to climate change, the season is lasting even longer. Dr. David Green of Baptist Medical Group in Gluckstadt is here to talk all about it. Thanks for joining us, Dr. Green.
Thanks for having me.
Talk to us a little bit about allergy season and just some of the symptoms that you see from patients who are coming in and out of your clinic.
Yeah, allergy season is definitely in heavy throes right now. Typically, we begin seeing it late February, early March with the warmer weather that we get, and then it lasts all through the spring. So throughout April, May, into June, just depends on, I guess, people's allergies. But a lot of the main symptoms that we see with that are runny nose, runny eyes, itchy eyes, red eyes, a lot of sneezing. You can have some coughing, some sinus congestion. And for a lot of people, that can be pretty intense, and it can range from mild symptoms or all the way to you're so fatigued and the symptoms are so severe that you can't go to school, you can't go to work. So it can really be a wide range of those symptoms.
So we've been dealing with pollen a lot lately. We've seen it everywhere. How harmful can pollen be to people during this time of the year?
Yeah, so it really just depends on the person. Some people, especially those with asthma or severe allergies, can have pretty intense symptoms and can wind up hospitalized, especially if it is a patient with asthma. Those allergies are what lead a lot of times to worsening those symptoms, and you can wind up in the hospital in kind of the most severe cases from that standpoint. But for others, if it's not severe enough to be hospitalized, can, like I mentioned before, you can be out of work, can miss several days of school, that kind of stuff. So it can really affect people's lives in a negative way.
Now, are there some things that people can do to reduce some of these symptoms as well as just protect yourself from these spring allergies?
Yeah, absolutely. So one of the big things is if you know you're going to be outside and you struggle with allergies, using a face cover of some sort, whether it's one of the gator masks or a paper mask, anything like that, just to prevent the allergens from ever coming in. Now, for a lot of people, that's, if you're working out in the heat, that's not really going to be the best option. So a lot of times I'll tell my patients when you're done working outside or you're done exercising or whatever, come in the house, wash your hands, wash your face, take a shower if you need to, just to reduce some of the further exposure to that. And then otherwise, we've got a lot of over-the-counter medications, nasal sprays, antihistamines, things like that, that people can take to help reduce some of those symptoms.
Some great information that I'm sure we all can use during this time of year. Thanks so much for joining us today, Dr. Green.
Thank you so much.